Hello, I'm Michael Buckley with the Bright Focus Foundation. We're fortunate today to be with Dr. Ranju Prasad, an optometrist at the University of Pennsylvania Medical Center. At the Penn Medical Center, Dr. Prasad directs a low vision rehabilitation center, and that's why she's here today to talk about some tips and some suggestions that can help us all get through the long pandemic winter. So Dr. Prasad, to start off, what are some of the challenges facing older Americans during the pandemic, particularly those with vision disease?
One of the things I've found is that many people are feeling a sense of loneliness and isolation. I think this is across the board for everyone because they can't be as social as they used to be. They're not out and about, and people with vision loss or visual disease and impairment, they're already at a risk for loneliness and isolation just based because of the grief that they're experiencing too. So there's even more of I would say, an exacerbation. So I find that people are finding it to be a lot worse, like the loneliness and isolation, just not being around people. Especially during the holidays too, they're not able to be around their loved ones as well, so they can't celebrate like they used to. And now I'm finding that, especially in colder climate areas like here in the Northeast where it's getting cold, you can't be social outdoors while being socially distant. So, those are, I think those two areas are what people tend to experience quite a bit of. I also find that people have difficulty shopping. Now that it's the holidays, they want to shop for presents. They're fearful of being around crowds, and also if they're around in crowds, they don't know if they're really socially distant from people too. They don't know how far apart people are. And there are also fears of going to the doctors again for the crowds, because of the crowds that they may see or may be around. And then also fears of their eyes getting worse because they're not going to the doctors as frequently as they used to.
I know it's hard for a lot of people to ask for help. Any tips?
I actually just tell people to ask. You'd be surprised how empathetic and sympathetic people are. And a lot of the times people don't understand the struggles that you're going through unless if you ask for help and you let them know. So yeah, so people are very willing to help. And also if there's certain things that you're a little, how would I put it? Kind of private about and you don't want to share it with others, definitely reach out to your providers, get the help that you need. And for those people who are part of the religious organizations, I say talk to your religious leaders. Just don't hesitate to ask for help. A lot of people don't know you're struggling unless you share it.
Great. Dr. Prasad, you mentioned people have concerns about their vision health if because of the pandemic their appointments are spread apart a little bit more. Any tips on how people can maintain good vision health when their appointments are not going to be as frequent?
Yeah. Well, one of the things that's really important, I think, is just to understand the nature of your eye condition if you have one. Learn about the course of the condition. Pay attention to any changes that you may notice, specifically with daily tasks such as reading, seeing faces, and even while walking around. If you find yourself bumping into things a little bit more, if you find that reading is hard for you, such as reading the newspaper. The newspaper is something that's very low contrast, so it's going to be harder to read if you've got decreased vision. So I think really paying a close attention to how you're seeing is important.
Great. So, Dr. Prasad, in many parts of the U.S., it's getting dark very early now. Any tips for how people can stay safe around the house in terms of tripping or falling at a time when there is that reduced light?
Yeah. One of the things to make sure is optimize the lighting in your house. I would say keep the pathways lit outdoors. So if you have pavement leading up to your front door, make sure that's lit. Make sure stairs are also lit. Like if you have steps going up, I know at my parents' house, they have multiple steps that go up to their house. And I always complain to them because it's not lit. It's even hard for me to see. So I think also getting a professional consultant to come out would also be helpful if needed. And also consider keeping your house clutter free as much as possible to make sure the pathways are all clear. And the other thing I just recently came across was they actually have smart light bulbs that you can connect with your app. do. So that way you can control your lighting right at your fingertips in your home as well. So you can, turn it up to the brightest when it's dark, or lower it down a little bit when you have some outdoor sunlight coming in.
That's great to know. And you mentioned the isolation and the loneliness, and I've heard people say that they think isolation is sort of the pandemic within the larger pandemic. This time of year when people like to gather for holidays, or birthdays or other events, and that's just not in the public health interest to do that. Any tips for how people can manage that?
Well, one of the things is virtual. Virtual is the way to go. Everything is virtual right now. So when you're planning when you had planned holiday gatherings in the past, right now it could be just done around things virtually. So for example, if you've been the host of always having the holiday dinners at your place, holiday meals, people always coming to you, you can consider preparing a menu, and have everybody cook individually, or you could cook, and if there's people locally, you could have them pick up or deliver food, have food delivered. Or if you have people that are people who are at different parts of the country, consider ordering meals that are locally. I know, a lot of parents, like my parents, they like to, be responsible for making the meals. So why not just find a place, order out, and have it delivered? Yeah, and another thing too is just have a virtual cooking session as well. So people can cook around the computer. And another thing is with holiday baking, which a lot of people like to do, consider baking and shipping. You can still be very active and be part of the enjoyment of holidays.
In your experience in your clinic, any tips to help people who might not be comfortable starting to do Zoom or telemed or any type of video interaction? I know this might not be familiar for some people. Have you had experience helping some of your patients this year?
Oh, absolutely. Absolutely. So we run a virtual support group, and it is available through Zoom, but a lot of the members still do not feel comfortable with the computer or on video. So they do call in. And I think that's just as effective too. Even though you can't physically see somebody, you're still on the phone, you're still on speaker. So there a lot of these virtual platforms have a call-in number, and also going back to just asking for help.
Mhm.
There's a lot of local agencies and national agencies that have tips that could help.
Great. So before we conclude, any final advice based off your experience during the pandemic and before to help our audience, get through what's going to be a difficult next few months, particularly those with low vision?
Um, I tell people what I would tell people is understand that you're not alone. We're all going through something very, very similar, with sight or without sight. Ask for help when you need it, and have faith. Just have faith that we'll all get through this time.
Well, great. Thank you very much, Dr. Ranju Prasad at the University of Pennsylvania Medical Center. On behalf of Bright Focus Foundation, thank you for giving us some very useful tips today. Thanks.
Thank you. Thanks for having me.